So I just want to thank everybody for attending the Courage Under Pressure for Florida's First Responders. My name's Charlie Thomas, and I'll be your moderator today. But my objective is to talk as little as possible. We have an amazing group of panelists that have volunteered their time to be here and share their stories. So over the next hour, we'll have some time to hear their stories and also let them answer any questions. I'll begin by introducing our panelists, and then we'll spend about 45 minutes letting them answer their questions. And then the last 15 minutes, we'll open it up to anybody in the audience to ask any questions they have for you guys. The first panelist I'd like to introduce is Dr. Kellie O'Dare. Ms. O'Dare is a dedicated researcher, educator, and advocate with expertise in first responders for health and wellness, health policy, and organizational resilience. She is the founder and the director of the Second Alarm Project and a research associate professor and deputy executive director of UFC Restores in the University of Central Florida. She has led innovative initiatives to support the mental health and resiliency of first responders and their families. Dr. O'Dare, is there anything else you'd like to add?
Thank you for having me today. I'm very grateful to be here and look forward to the conversation.
Awesome. Yeah, thank you for coming. Our second panelist is Tajuana Troy. Tajuana is a current deputy sheriff with the Department of Detention. After 24 years of working in corrections, Tajuana brings in a powerful blend of experience in law enforcement and mental health. Currently working towards licensure as a therapist, she hands-on experience in substance abuse and outpatient treatment, and she serves as a trusted peer support team member within her agency. Tajuana, is there anything else you would like me to add?
No, thank you.
All right. Yeah, thank you for being here as well. And last, our third panelist is Gary Gonzalez. Gary is a retired Miami-Dade Fire Rescue Battalion chief and avid meditator. In 2014, he led a co-research project with Dr. Jha and Scott Roger as co-directors of the Mindfulness program at the University of Miami. The project was designed to determine the effectiveness of a new mindfulness training program designed for the firefighter population. Gary continues teaching and leading mindfulness groups today. Gary, is there anything you would like to add? Oh, Gary, you're on mute.
No, Charles, thank you for that introduction and that reminder that I'm muted.
All right, so the first question I'd like to ask is for you, Dr. O'Dare. What led to the creation of that Second Alarm Project, and what unique services does it provide for first responders?
Sure, thank you. So I grew up in a fire service family. I'm also married to a firefighter paramedic. And one of the things that led to the development of this program was at one point, some of the leadership from the organization that he was working with at the time as a firefighter approached our faculty members and asked if we knew anything about mental health issues and PTSD with first responders. And at that point in time, we really didn't. And so, being, researchers, we dove in and started doing a lot of research on the prevalence of mental health concerns in first responders here. And at that time, I was living in the Florida Panhandle, so focusing on that area of Florida. And about that same time, we had a Category 5 hurricane, Hurricane Michael, come through the Florida Panhandle. And that really shone a lot of light on the mental health issues occurring within the first responder community, particularly in the aftermath of a disaster. So, fast forward to 2019, that was when the Second Alarm Project was formally born as a result of those factors. And really, what we were trying to do and what we continue to focus on is filling gaps in access to services among the first responder community, and that includes their families as well, making sure that there's occupationally competent providers in the communities to work with first responders and their families, and really also focusing on how to make this all sustainable. So we look comprehensively across the spectrum of care, providing that linkages to evidence-based treatment We do a lot of training and resiliency. We're using a model pretty heavily right now called the Struggle Well model. We build peer support teams and peer support networks. We do something called capacity building and technical assistance because, again, as I mentioned, one of our priorities is making sure that this is sustainable. So we want to be able to work with first responder organizations for them to be able to build their own very robust mental health programs within their organizations.
Wow, you guys do a lot.
Yeah.
Thank you. Yeah, we are trying to hit all the key points.
Yeah. I'm sure you'll talk a little bit more about some of those too as we go along today. So we're looking forward to it. Tajuana, my next question's for you. And what made you want to consider a career in mental health after your years of working as a corrections officer? And as you transition into your mental health therapy, what gaps in support do you hope to address with your peers?
Okay, so my story began 24 years ago. Coming out of the academy, when we come out the academy, we're placed on probation. So we don't get to choose where we work. We have to fill in wherever they need the availability. So I was placed out of all 21 people in the class, I was the only one placed in the mental health facility. I'm like, okay. So I believe this journey it was fate for me because that's when everything started, because that's when I started to see everything from different lenses when I started working in that mental health facility. During those years, rotating around, working different posts, I was able to work with both male and female in that facility. They had mild, moderate, and some severe mental health issues. And I didn't even know anything about mental health during that time. So we were giving some training, like basic training for the inmates about suicide prevention and how to keep their behavioral issues and stuff under control. But we weren't given any training for ourselves. There was no care for the staff. So it's like we're here side by side trying to help people without helping ourselves. So I always try to make my job easier. So working alongside with the mental health professionals that were brought in from the outside, I started to watch how they kind of interact with the inmates. And I'm like, okay, when they see them, it's like they bring a sense of calm to them, the way they de-escalated situations, how they connected with them. I'm like, okay, maybe I can learn some of these tools from the mental health professionals and use these in my daily responsibilities so I can make my job easier. So in the beginning, it was like I was making it about myself, but not realizing that I was really planting the seed to start this journey. So over the years, fast forward, witnessing firsthand, there's a deep intersection between incarceration, trauma, and mental health. So we work in these environments with individuals where people are not just dealing with consequences of their actions, they're struggling. They're struggling with untreated mental health conditions, substance use, the weight of broken families, like all types of complex issues that, we just don't understand. So I started to look at things a lot different. And then I started to ask myself like questions like, what can I do? Or is there something that could have been done before that could have changed like the trajectory of their path before they got here? So when I started to look within myself over time, I started looking at my coworkers different as well. And I'm like, wait, we're dealing with the same issues. Some of us have issues with substance abuse, anger, burnout, and so on. So we're suffering in silence. And then I had my own personal attack. Like I started having panic attacks, anxiety. I was out of work for 3 months. I didn't know what was wrong with me. Vertigo, it was so much stuff going on. And it kind of creeps up on you because it goes unseen and untreated for so long. And we don't realize the amount of stress that we're carrying every day being in these environments. without having the proper tools, coping skills. Nobody talked to us about coping strategies and stress management during that time. So that was a turning point for me to be like, okay, I need some help. I started using everything: mindfulness, prayer, acupuncture, journaling, everything that I can find, every tool. I started to use those things so I can begin to heal. And I started to share. And that was a huge part of it as well. Sharing my journey and my experience and helped me realize how important it was, not just for us to help the people that's in custody, but to take care of ourselves. Like, we must make ourselves a priority, because if we don't take care of ourselves, nobody will.
Yeah.
So why did I get into, what was the second part of the question?
As you transition to the mental health therapy, what gaps in support do you hope to address?
Oops, my pen fell. Sorry. So the gaps I hope to address were, first of all, I wanted to bridge just to bridge the gap between correctional culture and the therapeutic space, to make it normal so we can have a safe space to heal, because we're such a macho culture, because we have to be, and we don't realize it. So if you mention being vulnerable, it's a weakness automatically. Like, your coworkers will make fun of you, like, oh, you got scared, or you was about to cry. But we're human beings, but we don't think about those parts of it. So kind of to normalize, like, vulnerability is okay, and it's okay for us to say, look, we're not okay. Like, and there's a huge thing with trust and understanding with us. We don't trust people that don't look like us. So I think me having this unique background, coming from corrections, walking these same hallways, putting on that same uniform, but also understanding the importance of having a safe space to where you're not okay to be okay, from somebody that really truly understands. Because I've done the same work, so I get it. But now I can help on the flip side. So, and the reduction of stigma, like, we need to normalize conversations about stress, about trauma, and about resilience, because those things, they hold value. So sharing experiences is huge, and it matters. And prevention. We don't need to wait for a crisis to happen for us to get help. Like, we need to be proactive. So we need tools to be proactive, so we can have stress management skills, so we can have healthy coping mechanisms, so we know how to emotionally regulate ourselves, and then we can pass these things on to one another. So.
Yeah. Oh, thank you for sharing. And I think both other panelists would agree with what you just said. I saw Gary nodding his head a lot while you were talking. I'm sure everybody in the audience agrees with you as well. So Gary, kind of building off of that as well, tell us about your work with the U Mindfulness through the University of Miami and what you're doing there.
Sure. So 11 years ago, I had been introduced to Amishi Jha through someone who was running a newsletter providing people with information about all these mindfulness meditation opportunities. He was a mindfulness-based stress reduction instructor. And I talked to him about wanting to bring this practice to my department. And he shared with me that Amishi Jha, who's the professor of psychology and a neuropsychologist and a researcher at University of Miami, had just received a $25 million grant to evaluate the best way to deliver this practice to the U.S. Army. And one of the things that Tajuana mentioned was the macho nature of the first responder community. And so what we were doing was we were kind of masculinizing, if you will, this practice, because if it's something that's spiritual and esoteric, and it's seen as foofy in our cultures. And so we came up with the mindfulness-based attention training, MBAT, which sounds macho, right? MBAT. And And it truly is an attention training, which is what mindfulness is. And I had experienced firsthand about 4 years before I retired, really about 2 years before I retired. It took a couple of years for me to begin to recognize the benefit of this practice. And I wanted to share it because it is a powerful way to build resilience before you have to deal with the critical incident. So we formed a partnership. She saw the relevance between the two communities, the U.S. Army and the Fire Service, and and it was a success in terms of the outcome of the research. But I think Dr. O'Dare mentioned sustainability, and so that was the missing component back in 2013. And I don't think culturally the department was ready to embrace this, although we got a very good response from some of the firefighters. I think we got over 70 participants. So fast forward to November of last year, I get an email out of nowhere from Scott Rogers, who's Amishi Jaw's partner in this endeavor, asking if I'd be willing to be on an advisory panel for the LA County Fire Department because they're implementing a project with them. My daughter lives in LA, and I said, absolutely, I'll be on the panel. And by the way, won't be an inconvenience if you need to take me to LA. Initially, that wasn't going to happen because we were going to implement the program in January. However, LA was on fire in January. There were no firefighters available to listen to anything but their commanders on incident scenes. And so it got pushed to July. Originally, I recorded what I thought was a somewhat hokey video for them to take with them. However, because of the delay, money in the budget opened up and they took me. And I was blown away by their commitment to this. So the project is not much different than the original project, but it has sustainability components built in. And this is still under development. It's not something that's available, off the shelf type of thing. But the practice itself is really what it's about. And so I've known personally the benefits, and I wanted to share that practice with my department, and I want to embed it in the culture. And that's really the challenge.
Oh, thank you for sharing that, Gary, too. Kind of building off that, Tajuana, too, and then we'll go to Dr. O'Dare's, talking about the departments. Tajuana, how does your department approach the mental health support, and what worked and what didn't?
So early on, like I mentioned before, we were taught to do everything for the inmates, suicide risk and crisis. They gave us crisis intervention skills, de-escalation tools and stuff, but it was all just mostly inmate focused. So what didn't work was ignoring the staff ones. Because we weren't taught to really care for ourselves. And there's like a distrust between the EAP services that's provided to us because we fear retaliation. So we feel like if we're utilizing these services within a department, that it's going to get out. They may say we're unfit for duty, we can't do our jobs. And the whole vulnerability thing with talking to someone who works for the department, it wasn't a thing. It's just not working. But what is working now in the future, like me being part of the peer support advocacy team, I think it's an awesome tool to use because, like I mentioned before, offices helping offices. So it's a trust and a rapport that we need to build first before we can kind of normalize help, but it is the path to normalizing the help, because if we can learn to help each other, then maybe we can kind of begin to bridge that gap between trust and more of the EAP services and the things that they're trying to provide, for us now. So that's kind of like where we're at. So I think the peer support is a plus.
Yeah, so it sounds like they're making good progress towards helping with the mental health support, but not quite there yet.
Right.
Yeah. So, Dr. Adair, how does the Second Alarm Project work with individual departments to help raise awareness and training? And what do you guys do with the departments?
Initially, we were really focused on awareness level products and services and stigma reduction. But really, getting into this work, we quickly found that for the most part, not always, there's generally a fairly high level of awareness out there about mental health and the need to take care of your mental health. Again, not always. And in a lot of our smaller or more rural departments, is as mentioned, there's oftentimes some real challenges and barriers with the law enforcement communities. So, what we really kind of shifted to focusing on was concrete operationalized solutions that could be put into place right away, that departments or organizations could take and adapt to their needs. And so we've done that through a series of toolkits and workshops and communication resources that are tailored specifically to first responder organizations, always at no cost to the department, is freely available on our website. And again, with our department-wide trainings, we still have a mental health awareness training that we do that a lot of departments will want to do department-wide with their organization. So we're able to take, 3, 4 days, however long it takes to get into those organizations and to do these trainings to make sure that they can really operationalize their programs and services. And, we're really hitting the nail on the head, I think, with peer teams. Embedding the peer teams and the peer support structure into organizations has been absolutely key.
Mhm. Yeah, I've heard a kind of common theme among all three of y'all is the peer and having that macho because you can work with your firefighter, your corrections officer, or your peer to better help people. That's awesome to hear. Gary, let's kind of flip the page and from being an active, firefighter or corrections officer or police officer to being someone that's retired. What is life like as you transition, and what's it kind of do for your mental health as you transition from that world of constantly working to now what's your purpose? Gary, you're muted again.
Yeah. My brain's processing all these things. I'm hearing these wonderful things from our other panelists. I think retirement is hard for anyone because a lot of times your identity is related to your work. But in our profession, because we're facing life-threatening situations together, because we live together a third of our lives when we're working, because of the regular adrenaline rushes we get, because of in general, firefighters are thought of as the helpers, the heroes, and so the accolades and the support we get from the communities we serve. All those things go away instantly the day you walk out of the station. And if that's all you have ever known and ever do, it can be really, really hard on the psyche. I was thrilled to find out that LA County Fire Service has a peer support team dedicated just to retirees. And we talked about the peer support and why that's so important for first responders in general is that we truly don't trust anyone else to understand what we go through. And so to have a peer be the primary contact, we had a disastrous critical incident stress debriefing when I was a lieutenant another lifetime ago. And it was just getting up and running, and it was a civilian psychologist, and I really feel bad for her to this day because we were not friendly. We were angry, partly because it took 7 days for her to get to us, and partly because we had already, in our minds, processed it among ourselves. So that peer component is so important. So the mental health aspect, you lose this powerful purpose in your life, right? And so finding your next calling, if you will, the next place you want to help, because we get into this profession to help. That's what we gravitate toward. It took me about 2 years to fully adjust. And I mean, part of that service is what being a part of Northstar. And then for me, the mental health component is really important. And so that's why I wanted to pour myself into this resilience method, this tool, and try to get it to our fire service in a way that is acceptable and palatable to that community. It was helpful to be married. I mean, most of the time, because I had that support as well. So yeah, it definitely takes an emotional toll. And learning what I learned from the LA County Fire Service, that's going to be one of my pursuits. We kind of do it informally. By gathering with each other, retirees will have breakfast together and lunches together in different places, but it's not really the same thing. If you're struggling, it's probably not the place you're going to bring it up.
Yeah. Thank you for sharing that. And Dr. O'Dare, I know you guys do work with people that have retired. How do you help in that area of first responders that are retired now? How does Second Alarm Project help them stay plugged in, and what do you guys do?
So through a couple different components. The first one is having that dedicated cadre of retirees who do peer support is key. So helping them to stay engaged in different activities and different services and resources that we offer is also key. We actually just finished developing a peer support training that is specifically tailored to retirees, that is delivered by retirees. So that's been fantastic. We also have another example. One of our retirees who is also on our team just developed a bench project. It's where they built a bench in a local park, and it has a plaque on it, and it's a safe place to kind of come and meet. And they meet there a couple times a week, and they actually take a walk around this walking trail that's at the park. They do another couple of different meetups. So there's just so many examples of little projects like that out there in departments. So we kind of try to help support departments or individual retirees who are trying to develop programs for them within their departments.
Wow, that is awesome. I didn't even hear about that before. Can you find all the information on the Second Alarm page website, or like meetup
Absolutely, you
spots and stuff?
can. Yep, you can find that on our website or on our overarching organization, as you mentioned, is UCF Restores out of the University of Central Florida. So you can find a lot of information on the UCF Restores website as well.
Okay. And how do those connect together, UFC Restores and the Second Alarm Project?
So, Restores was developed in around 2013 and has been doing this work for a very long time. As I mentioned, the Second Alarm Project was developed in 2019, and in early 2025, so just a little bit earlier this year, we decided to merge. So we are now the same entity, all working together, on a shared mission and shared goals.
Okay. No, that's awesome. Thank you. So tomorrow we'll kind of flip the script and go away from firefighters and police officers, because correction officers, you guys face a very different type of stress compared to them. What are the most overlooked mental health challenges in that field?
Ooh, it's the micro traumas, the repetitive daily grind, going into these spaces. You don't know what your day is going to look like. We're always hyper vigilant, you know, breaking up fights, listening to repeated traumas about what happened to this person and that person, just performing daily duties with medical crisis. And you can have a fight and you can have a medical incident at the same time. And I think like the moral injury, it's like the dehumanization of watching other people being locked up and suffering. It affects us mentally. We don't think it does because we try to disassociate from it. But like seeing people treated less than human, like doors are closing, you know, if they get in trouble, they can't come out for another 20 hours. And it's like just that routine of restraint policies, and we have to follow the rules and make sure these people are following through with these things. It affects us different, and it creates burnout for us and fatigue and so much things that we don't even realize. And the secondary trauma, the PTSD, violence, suicides amongst ourselves. We're in the higher rate of suicide compared to not just the general public, but with all the first responders. And it's so like understudied, which is so strange to me because it's like if we are in the higher rates, why is it so quiet? I guess I don't know, because we don't deal with the public, or we're not seen as, you know, we're helping people more. We're in this moral injury type of work. I'm not sure. I haven't did any studies on it. Maybe Dr. O'Dare has some expertise on that area. But the chronic mandatory overtime, that is huge. You go to work, you don't know if you're going to be able to go home for the day because of the staff shortages. And that brings on a lot of fatigue and burnout for a lot of us, especially myself as well. It's like you may have some plans to do some things and you go into work and you're like, actually, no, you can't go home today. You have to work another shift. Like, and then once again, you know, we are a huge culture that discourages vulnerability, and we don't want to get help because we don't think anything is wrong with us. So I think that's what makes us a little more unique than the other first responder culture.
Wow. And there's a lot of things you just said that I never thought about, especially from your side. Dr. O'Dare, do you want to like comment on what she was talking about with the suicides um, among the corrections and even the fire department and police officers?
Sure. So I think, one of the biggest challenges that I've seen with first responder suicide is measuring and reporting it accurately. Right now, we really don't have a reliable and valid systematic way to track first responder suicides in the state of Florida. And it's certainly something that we've been working on with some partner organizations just to do a better job of being able to track and to report and track so we can monitor trends as is being said, and try to make some comparisons between professions and really see where resources are needed. But the little bit of information that we do have definitely does show some disparities among correctional officers. And as was mentioned, they've historically not been included in some of the other first responder resources. And I think that's because, and I believe this is still the case, they haven't statutorily been defined as a first responder, unless they're a sworn officer. A lot of the corrections officers are not sworn officers, and so they don't have that same level of designations as, say, a deputy sheriff or a police officer or law enforcement individual. So I think that may be part of the issue. We see similarities that with telecommunicators, with dispatchers. They just have very recently been changed in the statutory language in Florida to be classified as first responders. So hopefully we'll see some of that shifting. But I just think it's been historically underserved space with corrections. But I do think that's starting to change. I think there's champions from within, like yourself, who are stepping up to do this work, and other champions from within on the state level, some with Florida Department of Corrections. They're starting to do a lot of work in this space. And so I think we're seeing it shift and we're seeing it change. But I think your comments and your observations really are spot on.
It's wild to think that you guys weren't classified as first responders until a few years ago.
And
I'm glad to hear it's starting to change, though. Gary, what would you tell to a young firefighter that's just starting his career out how to build mental resilience?
Yeah. Well, of course, I'd want to teach them how to meditate. I mean, ideally, I want to see that happening in my own department, of course, but for the resiliency tools to be taught in fire college when they're not even out in the field yet. They're just learning their craft and have it be a serious part of their training. And encouraging them to seek out peer support. You know, our department has a fairly robust peer support program. And I wasn't even aware of that actually until fairly recently. And so I'd like to see that incorporation right from the beginning. And it's going to take ultimately a culture shift. And this practice could also go a long way toward to changing the culture about all of the things that prevent us from seeking out help.
Dr. Adair, how can families of responders be better in maintaining the mental health of their loved one that is in that first responder community?
Such an important question because it's really key to the health of not just the first responder, but of all of the family members themselves, including spouses, partners, significant others, and children. And so I think that first I would suggest starting with open and honest communication between the first responder and the spouse or partner about what the needs are and what the challenges are. Because we have to remember that the first responder needs that support, but the spouse in that situation needs the support as well. Participate in any type of family workshops that might be offered through the department. Those are also starting to become, more prevalent, although there certainly aren't widespread. And again, there's some differences between professions. More is being done in the fire service, some's being done in law enforcement, but they're just kind of sporadic. And another resource that we just finished building out, and this is on the UCF Restores website, is a whole workshop and video series for families of first responders that you can go and access for free. We call it Stronger Together Families Resources. So just really getting the word out that those resources are available for families to learn how to do some of these things that we're talking about, like the open and honest communication. And then really building routines of just basic self-care, resilience, and connection within the families that benefit the whole system. And we talk about resilience a lot in this work, but oftentimes it's not well defined. But fortunately, the thing about it is it's not really complicated. It's not complex. It's not a difficult topic. It's something that I use the analogy to fitness. So if you're trying to be more fit, you just don't go take a 1 day class on fitness and then boom, you're more fit. That's not how it works. You might go take the 1 day class and you might learn the strategies of nutrition and physical fitness and mindfulness and sleep and all of those things. And then you have to take those away and you have to actually practice them so that they become habit in your life. And resilience is the same way. And it's simple things like taking care of your body, nutrition, physical fitness, things like mindfulness is such a great tool to build resilience. So there's all these little things that we can do to build our resilience, and bringing that into the family component is critical.
That's a great analogy that we all start using.
Yeah, I
So,
like that.
Yeah, one of the things that I thought about as you were talking, Dr. Adair, is in our professions, I don't know if this is true of corrections, but I know it's true of firefighters and police officers. We tend to have a sense of entitlement. And that is incredibly destructive to your number one support network, which is your family, your spouse. And so thankfully, I kind of figured that out on my own pretty early, because what do you mean you want me to switch the laundry? I've just been saving lives all day, you know. Well, you've just been changing diapers, and then kind of realizing, wait a minute, my job is so rewarding, you know, just losing that sense of entitlement and realizing you're not really all that. I mean, you are, but you also have the incredible benefit serving in that capacity. And I think it would, I think it's also true of police officers. I don't know if it's true of corrections officers.
It is from a perspective of having a role of being an authoritative person, you know. So it's like you have this authority over people all the time. So from that perspective, yeah, it's hard to like pierce those walls. It's like, I tell people what to do, you don't tell me what to do, type of thing. And you don't realize that you're doing it because, you know, it's just embedded in your subconscious. So you don't realize you're operating in that space, and then you take it home because it's hard to shut it off when you can't recognize it. So yeah.
Yeah, when I was a battalion chief, they wouldn't even let me wash my coffee mug.
Wow.
No wonder you don't want to leave, Gary.
No, I definitely wanted to leave. I just wanted it to be the same at home. I'm kidding now.
So, Tajuana, what advice would you give your colleagues who are maybe hesitant to seek help because they fear it might affect their job security or the reputation or that macho status we've been hearing about?
I would say protecting yourself is protecting your family. It's protecting your coworkers. It's protecting your future, your mental health. Like, seeking help is not failure. It's not a weakness. It's a proactive step towards resilience and longevity for your life. It's about you, you know, maintaining a certain life. Okay, so from this perspective, like, we are told that working in these careers that we lose like 10, 15 years off our lives automatically already. So your lifespan is already shortened. So you're high risk. They give you the opportunity to retire in 25 years, but like, I'm retiring next year at 48, but the stress on your mind and body, you're more like 60 by the time you leave there if you're not really caring for yourself. So I think we have to change the way we view the things that we're doing it and the way that we're doing it. And it's okay for us to say, like, look, we're not okay when we're not okay. So we can heal, because life is happening, not just inside of these walls at work, but outside of work as well. So if we want to be more efficient, we want to be more effective and more healthy in our career and in our life, we need to take better care of ourselves and just get the help that we need and not wait for a crisis to happen for us to take preventative measures. If we want to have sustain whatever we have left within ourselves and in our lives, we have to make real connections and just do regular check-ins and just be okay with not being okay at times, because of understanding that we're not robots, because we get robotic in these jobs. It's so repetitive every day, and you know, you desensitize yourself from work, but you're doing it also with your families and your friends and everything around you. And also, when you were talking about retiring, like, I'm retiring, but thank God I'm transitioning into some work, something I love to do. So transitioning for me out, it's not as hard, but it's still hard. It's
Mhm.
still hard to let go of what I've been doing for almost 25 years. And it did bring on a sense of anxiety for me. And I had to go see my therapist, and it's like, I'm happy I'm retiring, but I'm also having anxiety. Like, what is really going on? Because you lose that community that you've worked so close with, and you spend so much time with these people. Like, more time you give them than you're really giving your family. You're drained by the time you get home. You don't even want to talk to your family. You're talking to people all day and communicating with them, and then it's like it gets cuts off like instantly. And now you're out in the world and you feel alone. You start to isolate. So when you said, Gary, when you said 2 years, I'm like, well, I hope it don't take me 2 years before I can find some stability, although I have another career that I'm starting. but it is scary. And I'm grateful for what you do, Dr. O'Dare, and all the programs, all the things that you have, because I didn't even know we even had any of these things that kind of existed. And I think a lot of us don't know. We don't have the resources and the information. We lack in those areas. So I'm definitely going to share everything that you have provided for me today with my colleagues, because we need this information. It's valuable and it's important for us. So thank you all.
It wasn't a 2 years was miserable and all of a sudden it was great. It was a process. I thought I was done after a year and I realized I wasn't.
Well, thank you for sharing that, Tawana. So our last question before we open it up is for you, Dr. O'Dare, is can you share a success story that illustrates how early intervention or proactive support can change an outcome for a first responder?
Sure. You know, there's so many powerful examples of this that I've been fortunate enough just to have a small part in over the years. We've seen things like improved quality of life, restored relationships, you know, suicide attempts that haven't happened because of an early intervention. Or, you know, we've seen suicide attempts that have happened, but we're able to intervene with that individual and get them connected to the right resources, and they're able to go on and heal and recover from that. You know, helping first responders either stay on the job or get back to the job, return to duty after a crisis situation has been very fulfilling and very rewarding and frequent. We just get consistent positive feedback from first responders and their family members that, you know, a responder might be really hesitant to seek help and resources at first for all the reasons that we've been talking about. But when they do, as long as they're connected with a good resource or a helpful resource, that it really can be life-changing. And so taking that first step and trusting is really important because we just want to send the message that there is hope and that recovery can happen and that you know, you can stay on the job or get back to the job, or you can, you know, mend that relationship that you might think was irreparable. All of these things are possible and we see them happening every day. So it's hard to narrow it down to one story when there's so many, but it just you know, it fills me with a lot of gratitude that we're able to do this work and to reach so many people.
Yeah, no, that's amazing. Thank you. So we'll open it up. If there's any questions that people in the audience have, feel free to share them. You can make it anonymous and we'll ask the panel. Uh, while someone might be typing their question, I do have a question for the whole group. What are some early warning signs that a first responder might be heading towards burnout or post-traumatic stress, and how can their peers intervene?
Uh, so one of the ways we self-medicate is through substance abuse. Um, and so an early sign would be testing positive on an annual physical, right? That you can't even control it to the point where you get clean before you have to, or getting caught, being pulled over for a DUI, getting charged with a DUI. These kind of things are really, you know, in my opinion, they're neon signs saying I need help. But you can also see changes in, I'll give you an example from my own personal experience. I had a call. It was a police officer who was ambushed while on an off-duty assignment. This police officer was, I worked with him often, a wonderful, wonderful person. We knew that there was a very little chance that he was going to survive, but we were the first unit on the scene, did everything we could, brought him to the trauma center. I saw pictures of his two kids. They were the same age as my two kids, and something in my brain, not conscious, but it said, I'm done with this. You know, I'm done with this stress, this trauma. And it was my crew who actually recognized, hey, Gary, I'm wondering if you're thinking about maybe taking some time off the truck. And because of that, because they were in tune with me and my attitude changing on calls, like if you had a broken arm, that was like having a cut finger in my mind, because I just dealt with this person, a pillar in the community, who was killed, you know. And so, yeah, just seeing an attitude change that doesn't seem to be explainable, these kinds of things. Or just knowing that there's a really traumatic situation and reaching out, you know, and saying, hey, are you okay? Fantastic person on our department lost his 58-year-old son recently. And we attended the memorial service, and he was absolutely fine at the memorial service. But I started thinking about what his life would be like a year later. So I started a group, a brunch group once a month called Reminiscing with this individual. And so invited firefighters that I knew this person would be receptive to. And through that, that's been going on for, I don't know, 6 months, maybe more. I just heard from him. It was just him and me the last time because everyone was too busy. Retirees, Tajuana, you're going to wonder how you got anything done at all while you were working when you're retired. You're gonna
Yeah.
you're gonna adjust and love it. Anyway, he told me that he's been going to other gatherings, so that was a huge positive sign for me. But just recognizing he's not going to be okay in a week, and he's going to be alone in a week, you know, that kind of thing.
Yeah, just to piggyback off what he said when he talked about like the substance use, um, the numbing of emotions and hearing that phrase, like, I don't care. Stop caring. You notice people being irritable and they don't want to be bothered. You know, they just start isolating, withdrawing. And but when you hear that phrase, like, I don't care, I don't care, and they don't care, they don't care about come to work late, like you see the signs and stuff. And I think a way for us to intervene is to really check in with the person and say, hey, listen, are you okay? Do you want to talk about it? Try to open up a conversation, you know, about stress so we can be more encouraging to get people professional help when they really need it and stop straying away from having uncomfortable conversations with people, because some parts of us are in those broken spaces too where we need to get help ourselves. So
Uh, Charlie, I just wanted to add something that I think is really important. As powerful a resiliency tool as mindfulness meditation is, it's not a panacea. However, it is attention training. So the way it helped me, it caught up to me at 59. So 9 years into retirement. And I was meditating every day, and I just fell off a cliff, ended up in a deep major depression. But what I knew, I had the awareness of what was happening to me. And so that led me to immediately seek help. And oftentimes folks just don't even realize they need help. So this is not a substitute for seeking out mental professionals to help you with whatever you're dealing with. I just want to make sure that's clear.
Oh, thank you. And Dr. Adair, I think you were going to say something.
Sure. I think that's such a great point that Gary just made as a follow-up. I think there is a level of personal accountability and responsibility that each of us has to take for our mental health. Again, making the analogy back to just like we do for our physical health. You know, we make sure that our physical health is in check. We go to the physician and get our annual screenings for different things. You know, we have to take a role in our own personal mental health as well, and you know, not continue to think that it's either not a priority at all or that it might be somebody else's responsibility. So I think that's important. And the only other thing I might add is that, you know, talking about signs and symptoms, you know, sometimes there aren't any. And so that can be something to keep in mind too. Sometimes people really do struggle in silence and they don't show any outward symptoms. So I think, a good strategy, as has been mentioned, is really knowing and connecting with your people and not expecting them to always reach out if something isn't okay. Because as much as I advocate for that personal responsibility, we know that it's not a huge part of our culture right now. And so reaching out doesn't always happen. So making sure that we're truly reaching in to the people that we care about and saying, hey, not just are you okay, but how are you doing? No, how are you really doing? And listening and opening up that space for those conversations and a difficult conversation potentially. And then the next step being, of course, if you hear something that's concerning during the course of that conversation, knowing what to do about it, knowing where the resources are to connect that person to care. But, sometimes it's just a matter of having that conversation and letting somebody kind of get some things off their chest has a lot of value.
Oh, absolutely. So as we're concluding, is there anything the three panels? Oh, Kellie, you got something?
Go ahead, Charlie.
Okay. I was gonna have any closing comments or anything you guys want to make sure we say before we get off of here.
I would like to ask Dr. O'Dare, has there been any thought about or movement toward programs to train officers? And the reason I ask that is because I remember being a rookie firefighter, and these senior officers and these chiefs are like gods to us, right? And so that's who ideally would be along with peer support, but that officer who works with this person every day, and just being trained in this component of wellness, of tools for the first responder.
So lots of talk about it and definitely some pockets and areas where it's being done, but nothing systemic, nothing, statewide or region wide or fire service wide or law enforcement wide. So I would definitely like to see it moving in that direction. I think it's really important, like you're saying, and not just training them to recognize signs and symptoms, but like true leadership training and how to create a culture where wellness is not an afterthought or an add-on. It is a foundational component of what organizations are doing.
Building trust.
Mhm.
Great question, Gary. Any other comments from any of the panelists?
I do have one more question. Because I found out independently that all the areas that I'm touching are connected. So, for example, Sean Campana was a lieutenant in my battalion for a long time. Claudine Buzzo is a union rep. Um, I, I didn't know that there were all these connections. So, did you know, Dr. Adair, that University of Miami is working on this resiliency program, MBAD? And I'm curious, how can we improve that uh, cooperation and collaboration and communication among all the parties that are trying to do something about this?
Yeah, I think that's a great question as well. I think it would be nice if there was, one organization who sort of coordinated all of that, especially maybe all of the university work that's being done in this space. So it's a little more coordinated. I think that would be helpful. But I do think that we've seen a lot of silos pop up where there could be some more coordination and collaboration. So I completely agree with you. I think that would really be helpful to the initiative overall because a lot of us are doing the same work or similar work with the same mission, just from different angles. And Sean's wonderful, by the way, too. She's amazing.
Yes, she is.
Well, I want to thank Tajuana and Dr. O'Dare and Gary for taking your time out of your day to come do this, and I hope someone finds it useful. I'm sure somebody will. But I do want to give a really special shout out to the Second Alarm Project and Dr. O'Dare. I know you guys are a true nonprofit, and so there's not always funding. So if someone's looking for something that's really important to them, I hope they can find you. And we'll be glad to share your website and any information with anybody that ever asks.
Thank you so much, and thank you again for the opportunity to be here and to talk with these wonderful panelists, and to you for moderating this and for hosting this. And I just think having these conversations is so important, and the more we have these conversations, the initiative will continue to grow.
Absolutely. And I can't take all the credit. It was Tajuana that gave me the idea.
You keep saying that.
But I will say, Charlie, someday when you retire, I can see you like finding another purpose in talk show host. I mean, you did great.
I don't know about that one, Gary. I got a few years so I can retire.
He might be on to something, Charlie.
Yeah. All right. Well, thank you guys, and thank you for coming out.